So tonight what we're going to be talking about is how does neurological care actually work in the brain itself, and why do I use the different technologies that I use. So we'll get a good little starter. What we're looking at is how does the brain actually get subluxated. Now, what we've been taught by a lot of professionals is that subluxation is actually in the back. That's not actually true. The subluxation is in the brain. One of the symptoms is that the back rotates out of position. So how the subluxation happens is that one part of the brain, and I'm making very simplistic, it happens at every level, will become stronger than the other. And as a byproduct, when the brain's stronger, it'll cause the musculature on this side to be stronger, this side to be weaker, and then the bones will rotate. So that's a simple explanation of why the bones actually rotate and why on X-ray you can see changes in the spine. Now what we're going to look at though is what are the things that cause us to subluxate, and from them, how do they cause us to cause these subluxations where we get organ dysfunctions, glandular dysfunctions, muscle dysfunctions. So the three causes are the three T's. So we got thoughts, traumas, toxins. So thoughts, how we think, how we deal with stress, traumas, slips, falls, as well as the trauma one can be any bacterial or viral infections. And then toxins, anything we eat, drink, or breathe, including any pharmaceuticals. So all of these cause our brain to go into what's called beta. Now, there are different layers of beta. The simplistic way for us to understand, beta runs from 12 to 40 hertz. We don't even need to know that. We need to know that 22 to 40 is where we make sickness. Low beta is okay, but high beta, which is 22 to 40 hertz, is where muscles get tight, where we grow sickness, where we grow disease. So usually I just say beta is bad, but that's not true. Not all of beta is bad. High beta, high stress, high energy consumption, that's what makes us sick. So what we want to do is get out of that high beta of that 22 to 40 hertz and get down into low beta, alpha, theta. We could do delta, but usually you're sleeping delta because it's deep, deep, relaxing sleep. So right in here is SMR, it's sensorimotor rhythm as well. So simplistically, too much of this will make you sick, and these frequencies will make you healthy. Now, if we want to think about these frequencies, SMR is equivalent to REM sleep when you're awake. So what happens when you're sleeping? You'll be going through sleep and you go from the stages of beta to alpha to theta to delta, and then you'll fluctuate between theta and delta as you're sleeping, and then you'll go into rapid eye movement or REM sleep. And that's when your body actually puts your whole body in a state of like ketosis, or basically it won't move. Ketosis is probably not the right word, but you can't move, and then you'll go into SMR, and that's when your eyes start moving. And it's actually sending the information to different places. So that's what REM sleep is. And REM sleep is SMR, or the sensorimotor rhythm, going on. So what we'll notice is when we put people in this, they'll start twitching and moving because they're dealing with ideas that they had processed that day. And the reason why the body puts you into a form where you can't move is because if you are processing the information and you can move, then you can get up and start doing crazy things and sleepwalking and doing these things because your body is not adapting correctly, and that's a subluxated brain. Does that make sense? So, simplistically, too much beta makes us sick. Alpha, theta, and SMR and delta are the good healing frequencies. Now what happens with this is when your body is dealing with stressors, these stressors literally indicate how you're going to react. So a simple explanation of this is we're in Colorado right now, everything's changing and there's lots of pollen coming out. Now people have allergies. Now here's my question. if the pollen is the cause of the allergy, why do I not get allergies and somebody else does? Because the answer is pollen isn't the cause of the allergies. The inability to adapt to the pollen is what causes the allergies. If one person adapts, they're fine. If another person doesn't, they're sick. So I had a patient come in, or I still have a patient coming in, and he had allergies to dogs. What happened to him is his brain was in beta, and let's say this is the nerve. That's a crappy looking nerve. And this nerve is in a stress state, and he's dealing with stress. And when he's dealing with stress, allergies are this reaction, and health is this reaction. So allergy is going to be another nerve in a beta state. And what this means is the frequency to which the brain communicates at. So if you take in information and you take it through beta, it doesn't matter what it is, it's going to be seen as bad if you're in a high beta state. That's how we get stuck ruminating or thinking about stuff over and over and over again, is we get stuck in neural loops, or it's called limbic spins. And what happened here is beta is the one that's making him sick. Alpha, or theta, is the one that's helping him. Now the reason why I'm showing it like this is dog hair. That's what this neural loop is, dog hair. Now he was allergic to it, and he had 4 dogs. So the reason why I bring this up is dog hair is causing him to go into beta, which causes him to produce histamine reaction, which causes him to get more sick. Now we've taken care of him, and what we did is we had him bring in the allergen, which was dog hair. And what happens is the dog hair came in, and then we adjusted him. Now this is what's really cool about the adjustment. The adjustment instantly turns off beta. So if it turns off beta, and it actually grows a new neural pathway that says dog hair is good, not dog hair is bad. And in growing that new neural pathway, now it comes in and it goes this way. And when it does that, the frequency is going to be alpha or theta or SMR. Each one's different depending on the person. As long as it's not in beta, they're going to be okay. So we adjusted him. Changed the frequency of his brain, because the adjustment actually takes you out of beta or stress and instantly puts you into alpha or theta. What we did though is we had the stimulant of the dog hair to teach his brain that the dog hair is good. So it goes into alpha. The reason why I'm telling you this is the adjustment is what changes this. That's how powerful the adjustment is. It changes your perception of the world, subconsciously and consciously. So what does that mean? We did this twice. He came in, and in my office I'll do a little bit of applied kinesiology, which means that we'll muscle test, and we'll see how the body adapts to different things. If the muscle goes weak, it usually indicates they're allergic to, or they have some sort of neurological response that is poor to it. So we muscle test to it. We found that he was poor to it. We put the hair on him, and we adjusted him. Then he got strong. It means his brain changed the pathway. Now, why I'm explaining this is the adjustment does the same thing, doesn't matter what we're working on. It doesn't have to be specifically for allergies. It can be for low back pain, it can be for headaches, it can be for PMS, it can be for a hormone imbalance, it can be an organ imbalance. It doesn't matter what the problem is, it's all from a bad neural loop. It's going to bad or beta instead of alpha or theta. Then what we do is we put the brain on brain tap. And what brain tap is a way to exercise this new loop. And when you keep exercising it, it grows stronger and stronger and stronger. Now what happens here, if we go back to this loop, and we have the nerve here, this is the bad one, and this is the good one. Right here at the end, where the neural junction is, this nerve produces what's called neural growth factor. And simplistically what that is sticky protein. It's a protein that makes it stick together better. The more that it fires good, the more that protein goes here. And there's a limited amount. You have only so much per day, let's say a gram. So you got 1 gram per day. I'm just making up numbers. As you say, you got 1 gram. Well, if you use 75% of it here and only 25% of it here, then this nerve starts to die and this one gets stronger. This is literally how neuroplasticity works. This is why it says nerves that fire together, wire together. So what we did, by adjusting, we made new neurons, and then by using brain tap, we train the neurons to keep firing the right way. And it trains them to stay in that relaxed state. Because remember, this bad pathway is going to be a beta pathway. A pathway that causes sickness and disease. The high beta frequency. Which means it resonates at between 22 to 40 hertz. Simplistically, it's going to look like a wave like this. And that erratic wave is what causes sickness and disease. Where this pathway is going to be more of a sine wave or a cosine wave, and it's going to allow us to heal. So by making this new one fire, it works even better. That's what neuroentrainment does. And how that works is it uses the same principle as a tuning fork and a piano would be played. So if you play the piano at the right note, then the tuning fork will ring. And then you know you had it tuned correctly. The same thing happens with your brain. When we put the frequency in, it will actually make the brain resonate or vibrate at that right frequency. So that works good. The brain tap works well, but it's still kind of global because we're training the whole brain. What's at a higher level is called neurofeedback. And so with neurofeedback, what we do is we look at this same neural pathway pattern, but then we find out specifically in the whole brain where in the brain is the problem. If it's a visual cortex issue, we're going to look up in the back of the brain. If it's auditory, we're looking at a different area. If it's a speaking thing, a different area. If it's a muscle tone, it's a different area. And so each area of the brain has a correlation to what it's running. And then what we'll do is we'll find the frequency of theta, beta, delta, or whatever it is. And it's not going to be beta, but theta, alpha, gamma, and we'll train it. So what happened is I have a patient who came in and she had a stroke. She had a stroke right over the part of her brain that controls speech. It's called Broca's area. And what we did is we adjusted her, and in adjusting her, we made this part of the brain aware that it can communicate, made new neurons there, but then we trained it. So we took an EEG lobe, or electroencephalograph probe, put it right here. Now it's not going into the brain, it's just on the outside. And then we trained the brain to fire at the frequency of health. For that specific area, I believe I did SMR. And what we did with that is we trained the frequency to fire correctly, and because this controlled speech, this lady in one visit walked in with 5% speech and walked out with 95% speech. Because we trained the part of the brain that controls that part of the body. The same thing can be done with the back of the brain. We can help people with the ability to quiet themselves. So people who have PTSD, ADD, ADHD, they have a quieting issue in the back of the brain. Because the back of the brain, its job is to literally quiet everything. Because 75% of all the neurons in the body are right back here. And it actually controls your ability to calm down and not get stuck on things. So this part of the brain is supposed to be relaxing. So this is the back of the head, and this is where your face would be. So your face, your eyes would be right here, your nose, and oh, that looks like a bird. So that's what it would look like. So the biggest brain injury that you can have is if you fall backwards and hit the back of your head. Because then you make this pack of the brain that's supposed to be working at what's called theta, or a calming frequency, go up into beta, which makes everything go into beta, and then guess what happens? They get crazy diseases. They start getting neurodegenerative diseases like diabetes, rheumatoid arthritis, MS, depression, anxiety. All these different things are byproduct of the brain making the body sick. So what we want to see is the whole brain being cohesive and working at the right frequencies, and then being able to turn on and turn off at will, and then your body heals. So the reason why I use the goggles or the brain tap, and the reason why I use neurofeedback and biofeedback is to literally change the brain and have the frequencies communicate correctly. And when they communicate correctly, you actually heal. The healing is in the frequencies staying that way. Now the reason why other chiropractors or doctors have talked about holding or not holding is because if your brain can't stay in the frequency it needs to be in, such as an alpha frequency or a theta frequency, and you get stressed, you go back into beta, and then you go back into the old way of being, which got you sick. But when you get adjusted, the new pathway will make, and then if we train it with the brain tap or the neurofeedback, we train it to be in the new frequency, and then the old neural pathway dies, and then you heal. So that is the difference. It's the holding of the adjustment is where the neurological component comes in. Every chiropractic adjustment, if done correctly, will change the brain pathways. But the getting to hold it and knowing where to train it is what makes it neurological. Because the training and knowing exactly how to make the brain either speed up or slow down is the difference between seeing a miracle and having a routine adjustment. Do you guys have any questions? Yes.
How long can it take usually, do you see, with each different device?
So the neurofeedback will train the new pathways instantly. As soon as you do the neurofeedback, that's basically, you've trained it to be different. So you've literally used up majority of the old pathways and the new ones are taking over. So the neurofeedback, I like to say, is equivalent to 25, or between 20 to 50 brain tap sessions. Because the neurofeedback is just that much stronger in fortifying it because it's very specific. Where the neuroentrainment or the brain tap is a global and it works, it's just more cost effective for people, so that's what I usually put them on. Does that make sense?
Mm-hmm.
Yeah.
How do you measure beta versus alpha or something else?
Excellent. So what we have, you want to scroll over here? So what we have is, this is the stress response test. So when you do the stress response test, we actually measure beta, SMR, alpha, and theta at a specific region in the brain. Now we do this in a general test, and it also shows me how the body's responding. So what happens here is if the body is responding correctly, beta will be up and down, and it'll be at roughly 30, it's supposed to be 32% of the brain. But it turns on and off. Whereas all the other ones are gray bars, which means they turn on when the body's relaxing or your eyes are closed. This is how you measure that, is with the EEG test that we do here, the stress response evaluation. Now this is different because we're not looking at the x-rays crooked or not. We're looking at what's causing the bones to be crooked. We're looking at what's causing the organs to be sick, which is the brain waves. This gives me an overall view of how the brain's doing. Now if that's not enough and we want to go real in depth and find out what part of the brain is not working, then the next level of testing would be what's called a clinical Q. And it tests the 5 points on the brain that have 95% of the dysfunctions. Now if that's not enough and we still have issues, then we refer the patient out for what's called a QEEG. Now this has to be done at a hospital because we need the actual frequencies to know where to train. And so the QEEG, if I remember correctly, is 21 leads all over the head, and you're literally plastered with all this paste, and then you do different testing, and it gives me a report back that's literally this thick, and then I know exactly what frequencies are in each part of the brain and how to train it. Majority of the time, this and the clinical Q will give me everything I need. If it's a real extreme case, then we may have to send out for a QEEG. Did I answer your question? Somewhat? Okay, so basically the ratios in the different parts of the brain let me know how you're doing. And I made it real simplistic and said that beta is the only thing, and it's not that simplistic. I just wanted to make it easy for you guys to understand. That relates to one part of the brain. Each part of the brain has a dominant frequency, and that dominant frequency determines if it's healthy or sick. So say we have somebody who has too much theta. So theta is asleep, is basically your body's asleep. And it's over what's called the sensorimotor strip. that person's gonna start having seizures then, grand mal, petit mal. So with them, now we gotta upregulate what's called SMR. Say we have a person that has too much theta or alpha in the front of their brain. That's the lower frequencies. Well, that's not what we want, because we want to see beta, or the ability to engage in the front of the brain. So if they have too much of that, then they're going to have ADD or ADHD, and then we have to upregulate beta. So each part of the brain has a frequency that's correlated to. But simplistically, where most problems come from is the back of the brain having too much of the high frequency, and we got to calm it down. I just didn't want to get into that because it can get really convoluted and going all over the place. But simplistically, the part of the brain that needs to be calm is what we want to change. Or the part of the brain that needs to be stimulated is what we want to change. And in doing the feedback, it really changes everything. So this gives me a broad overview of how the brain is, but exactly how the body's autonomic or stress response is being turned on. Then we go into more advanced neurology, where we look at the QEEG. And the QEEG gives me 95% of the problems. So it's very simple and quick. And then if we need to, we can do, or a clinical QMEan. And then if we need to, we can do a QEEG. Now that is going to have tons of probes, and that's going to take a couple hours. Where these tests are in the minutes, that's in hours. So we start at the least time invasion to the most, depending on how much change we need to do. And what I like to do is every 20 visits or 3 months, we do a retest, and we see how much of your brain has changed. Because the interesting thing about this is that if you talk to most neuroscientists, they say the brain cannot change. They say that it's static, that it will work the same way. And I see this because I have patients come in who've had seizures, who've had traumatic brain injuries, and they say that nerve will never turn on, that part of the brain will never turn on. But with the proper adjustment that opens up and makes neurons and the training, it will regrow. And that's why we saw the seizures going away with the one lady. And we saw the strokes going away, or the symptoms of the stroke going away. So I never say that I take care of those symptoms. But what I will say is that I'll change the brain, and when the brain works right, guess what happens? Those problems go away. Did I answer your question? Excellent. Any other questions? Awesome. So thank you guys for listening, and have a blessed night.